I am Margaret Lowe Smith. I am the president of Atlantic Live, and I'm delighted to welcome you all to this Atlantic Exchange tonight. It's wonderful to have you all here for a conversation about mental health with the senior senator from Michigan, Debbie Stabenow. We like to think of Atlantic Exchanges as one-on-one conversations between Atlantic editors and fascinating people doing really important things. Throughout our Atlantic's 158-year history, we've been committed to bold ideas, addressing the most pressing issues of our time and addressing timeless issues. We're here tonight to bring that commitment to life. Our exchanges here have featured everybody from Bill Gates to Mark Zuckerberg, Rahm Emanuel, Penny Pritzker, and tonight we're delighted to add Debbie Stabenow to that list. The National Institutes of Mental Health estimate that nearly 1 in 5 people in this country has some form of mental illness, and many people don't get the medical care they deserve, a need that the senator takes very, very seriously. Her goal is to make sure that mental health gets the same attention and resources as physical health. Her work on the Excellence in Mental Health Act, bipartisan legislation that became law last April, will expand access to community health services and provide more access to treatment and research. Before we dive in, I want to let you know that you can tweet at the Atlantic_live during the course of this conversation and use the hashtag ATLX. That's ATLX. We'll have time for all of your questions at the end of the conversation. For any of your friends and colleagues who couldn't be here tonight, they can join us virtually via our live stream. That's at theatlantic.com/live. Now, without further ado, it gives me great pleasure to introduce the senator from Michigan, Debbie Stabenow, and my wonderful colleague, Steve Clemons, Atlantic editor-at-large, to lead the conversation.
And I'm going to do a little freelancing because I want to ask
All right.
a good friend, someone who's both become a friend and also supporting tonight's event is the National Council on Behavioral Health's president and CEO, Glinda Rosenberg, who I just want to say a couple words about. You're just awesome. And, you know, we got to know each other because, one, I don't remember who I basically gave credit for being president, but it was one of your wonderful colleagues. And they came up to me after we did one of our health forums or technology in health or something like that, and I began, without prompting, to sort of talk about mental health issues as a serious issue that needed to be discussed in a whole variety of different ways. And we became friends from that. So I want to thank you for supporting us. I want to ask you to say a few words before we get going. Would you join us, Linda?
Yay, Linda.
Yay.
How are you? Thank you.
So as Steve said, I have the privilege of being the president and CEO of the National Council, and I am just delighted to be here. This is my first event.
Wow.
It is a beautiful, beautiful venue, but what's most important is it's a chance, just very briefly, to pay tribute to Senator Stabenow. You know, I have a favorite quote, and it goes like this: you shouldn't go through life with a catcher's mitt on both hands. You need to be able to throw something back. And it always makes me think of you, Senator, because you always throw back. You know, when people in Congress were just thinking about the mental health needs of veterans, they were talking about the tragedies in Tucson, Aurora, and Sandy Hook. You actually did something. And you reached across the aisle when people said it couldn't be done. You created an unstoppable alliance, and as everyone heard earlier, in April, the Excellence in Mental Health Act was passed. And when we help one person, we help more than that person. We help their family, and we help their community. So on behalf of the 2,200 safety net organizations we represent, including all the mental health centers in Michigan, and the 8 million men, women, and children they serve, we are very grateful to you. You serve with great distinction, and we are very pleased to be able to help tonight. And Steve, we are always impressed with you.
Yay.
So I get to see the face-off between the two of you.
Linda, thank you very much. It's all downhill from this point.
Thank you.
Thank you.
Thank you. So, Senator, thank you so much for joining us.
I
I'm
am
glad
so
we were able to
happy.
talk about the Farm Bill tonight.
Yes,
And
yes.
that you got through, you know, and how that
Fresh fruits and
affected your mental
vegetables.
health.
Yes,
right?
yeah. Well, actually, I needed some help after that. So
Well, I was reading some of the great comments that the President and other people said about the role you played in the Farm Bill. And I raised the Farm Bill not in a facetious way. You folks may not understand, unless you've worked in the Senate, how tremendously difficult it is in this environment to move anything. And so Debbie Stabenow moved the Farm Bill through. She got it passed, it was done, but she also moved the Excellence in Mental Health Act, which is smaller but perhaps as significant, even if not more significant from my vantage point. And I wanted to talk to you about it for a minute, because when people see something like a piece of legislation like that Mental Health Act,
right.
Okay, do they think the box has been checked off now?
Well, I don't think the box has been checked off.
I mean,
there are.
It was sort of a pinky in the door, right?
Yeah.
Or the kind of toenail to the pinky in the door.
Right.
Right? So,
well, we are, and by the way, first of all, happy St. Patrick's Day.
Yes.
Can you tell I'm Irish? You can tell I'm Irish, right? Okay. So, but the essence, let me back up for 1 second and just say, when I look at this continuum, because I think this is really important. It was a little over 50 years ago that President Kennedy signed the Community Mental Health Act, right?
wow.
And then we went a long time of up and down, some funding, closing hospitals, but not providing community care, and just, all of this wrestling, right? Little block grants federally, 150 million, or if we're lucky, or 100 million, whatever block grants that was spread out all over the country. Then we came to two things, and I say this just because to me they really fit together. One, the Affordable Care Act, where after the wonderful advocacy of Senator Paul Wellstone, Senator Ted Kennedy, I picked up the ball in the Finance Committee to make sure we got mental health parity for insurance, which we have now. You cannot charge a different copay for mental health services or substance abuse services. You can't charge 50% copay and 20% copay with everything else.
Now, when you walk through an airport, do people run up and say thank you for that?
Oh, all the time.
Do they know it?
No. Actually, people don't. People will, but people, when I say it, people said, oh, thank you, I didn't know you did that, or I didn't know, but I did, and I didn't know that happened, and then until something happens in their family.
Right.
Frankly. But then the final piece, the reason I mention this, is on the community end, and that's where the Excellence in Mental Health Act came in, because it's in the community with people who don't have insurance, or may not have insurance, going through community mental health boards and services in the community, where we have had such a huge disparity. So the Excellence in Mental Health Act originally was set up for all 50 states, basically set up community behavioral health clinics like we have federally qualified health clinics.
We have how many of them now, about 8?
Well, we're doing 8 states as a
Right.
pilot. Now, originally we wanted, of course, everyone. But the reason I say this is not just a little tiny thing. The 8 states, and starting in May, states are going to be able to apply for planning grants, up to 25 states, and then they will put together a plan with communities, working with veterans, working with community mental health centers, however they want to put it together in the community. Then by next summer, we will hopefully have money out the door for this. But this is only step 1. This is not the end. It's not some little pilot project that will go away. This is step 1 to having funding parity for community mental health services, for community mental health and substance abuse. So it's behavioral health services. And it's the final piece of, and it's extremely important. I was very appreciative and proud to have Senator Roy Blunt with me. This really was a
I keep bumping
bipartisan
into him
effort.
and thanking him for the role he played.
He was very key.
He's very proud of this.
He is, and he was very key at a moment. We did this very quietly as opposed to the Farm Bill, which was this multi-year, on and on and on. This was something that we worked on very, very hard and attached it to.
Were there any enemies of the bill? Maybe enemies.
There were people
Strong
that
word.
don't.
How about people with skewed priorities?
Yes,
Yeah.
the people who believe that we shouldn't spend dollars on anything were opposed.
I see.
And so that's why we said, okay, we'll make it a pilot project.
Any of them running for president?
Yeah, a few, yeah. Yeah, you could probably guess who, actually. And so...
Trying to create tweetable moments for
yes,
yes. For the audience.
There are a few. There were a few. But we basically got it to a manageable amount, although I have to say, in times of no dollars being expended, we basically added $1 billion to the what's called the Doc Fix bill, the Medicare reimbursement for doctors, which they said no new money. This is short term. Can't do anything. Basically what we heard was can't do it. No new money. No new money. I kept saying why? Where is that written down? I don't see that anywhere in the Constitution. I don't say. Tell me why. Tell me why. Tell me why. And then so a lot of push, and basically it was. I think that I just caused them to finally go, okay, stop it. Will you please quit calling me at 10 o'clock at night on Saturday night? And okay. And, but so to get $1 billion is a lot of money for community mental health, given the fact that we fight like crazy to get, $100 million spread nationally every year. So, and the most important thing is the principle in this, that for the first time we are saying, just as you reimbursed fully for health services at community clinics, we will reimburse fully for behavioral health, for mental health and substance abuse. So that was the most important thing to me, to say that piece of mental health, the final piece of mental health parity will be eliminated. So we can honestly say we are treating illnesses above the neck equally to illnesses below the neck. That was the goal.
How did you become so obsessive about this particular issue?
I have a personal story, Steve. I do. I have a personal
Can you
story.
share?
And absolutely. I grew up in a little town in northern Michigan. My mom was a nurse, actually the director of nursing at a small hospital. My dad and my grandpa had a car dealership. And when I was probably late elementary school, my dad started having behavior that we couldn't identify. Now we know he was bipolar. At the time, he would have highs, he would have lows. He'd had more highs than lows. He was a wonderful, loving man. People would come into the car dealership and he would give them all our money, and it was very much about, it was just not good judgment and so on. So finally, he had to be involuntarily placed in a hospital. There was nothing. Everybody at that time, this was in the early 60s, everybody was paranoid schizophrenic. That was the label. And
So one size fits all.
one size fits all. My dad ended up in Traverse City State Hospital in northern Michigan. When I saw the movie, One Flew Over the Cuckoo's Nest, I cried and cried and cried because that was what my dad was in. My dad told stories later of having shock treatments, and he was a very, very religious man, a man of great faith, and how he would just say the Lord's Prayer the whole time. And it was just, I have visions of going to visit my dad in this place that was, and so he would come out, the highs would go away, he'd come out, he'd be fine. They'd put him on Thorazine, which had nothing to do with anything, but would make him shake and he couldn't work. So he would go off the Thorazine, and then 6 months later, he would be back up again. So this went on and on and on. So, and it was, everything that comes with that. We lost our house, we lost business, and it was a very tough time. So I go to Michigan State University, also green and white, by the way. And
Rub
this
it
is
in.
dual
Okay.
effort, and I'm studying, not surprisingly, psychology and sociology, and I actually have an MSW. But I'm sitting in a big lecture hall, and this is like 1972, something like that, 71, 72, something. And they bring in this new psychiatrist, this young hippie psychiatrist who's got this new breakthrough on this new diagnosis and this new medication. And he proceeds to talk about manic depression. And I'm sitting there and he's describing my father. And it was like, oh my gosh, somebody is actually identifying my father's illness. And he talked about lithium.
Wow.
And so afterwards I went down to talk to him and described everything. And he said, have your dad come down and see me. So they were up in Clare, about an hour and a half away. They came down. And my dad ended up going to a hospital for 30 days, a regular hospital, to be regulated on lithium, and never went back in the hospital again. And I'm not saying that medication is the only thing. I mean, obviously therapy, obviously there's a lot of pieces, but you know, bipolar is a chemical imbalance in the brain. It is no different, I would say, health-wise, than saying somebody's diabetic and you need to monitor your sugar, and nobody, you know, there's no stigma related to that, right? And there's ways to manage your disease and so on. We now have ways to manage bipolar. So, but I saw what my dad went through, and he lived the rest of his life successful and working, but it took a heavy, heavy toll.
You know, I have become very interested in the subject of broad mental health, in part because of Linda, her colleagues, and others,
Sure.
and sort of digging into it. And you know, to be honest, I had no idea in my own family how many people had challenges. And when you go back and scratch beneath the surface, you see it's everywhere. And I'm wondering whether your experience with this has, whether you see a tectonic shift in people's willingness to reveal, to step out. Linda's having this giant conference, what is it, April 21st in Florida? Am I allowed to speak about it, or is it a secret? Yeah, April 21st. It's Orlando, right? And you've got, 4,000 some odd people coming, I think. But it seems to me that 3, 4, 5 years ago that wouldn't have happened, that this was the uncomfortable ailment or ailments in a window of things.
Well, and I would say, first of all, 1 out of 4 people in our country are affected by mental illness every year. 1 out of 4. Now, and it is less for very, very serious illnesses, and there are ranges, but 1 out of 4.
But do you feel that it's changing, that recognition of that is changing?
Yes, and the other thing that I found is that as I have shared in the last few years with my colleagues, my story, once I do, then they will share theirs. And it's amazing to me to watch the number of people who've come up and said to me, oh, my daughter's bipolar, my son-in-law is bipolar, or you know, is affective disorders or schizophrenia or whatever. People, once you give permission by telling your story, which is why I tell it so much, is that people will then come forward and say, oh, this is what happened in my family. You know, it is hard with mental illness in terms of stigma because it affects the brain and it affects behavior, and so we think of it differently. Anyone here can be ill and managing a disease right now, but if we don't see it, you know, it's different. But if it's behavior, then it is scary or not understandable, or we put all kinds of labels on it. And that's what we have to get beyond. And we have to understand depression is real. We have to understand, I mean, the Iraq and Afghanistan veterans were incredibly important, along with the National Council, in passing our bill. 22, in fact, it's changed now. It's 23 veterans every day commit suicide. Every day, every day. And so, number 1 issue for Iraq and Afghanistan veterans.
Yeah.
And so, so we have to be able to speak about this. You know, these are illnesses. And the good news is there is hope. You know, back when this was happening for my dad, it was very scary and nobody understood it. Even though my mom was a nurse and she was, I mean, she had resources of the community, doctors and stuff. People didn't understand what was going on. And there was a sense of hopelessness. There is not a sense of hopelessness anymore. There is hope.
So vets are coming over, and I remember people like Ron Kovic after Vietnam War came over, and there was a lot of focus about the impact of that. Right now, I'm going to get Kevin Barron in here shortly because he's with Defense One, and this issue of returning vets is a large one, particularly now. It's been popularized a bit more with American Sniper and Bradley Cooper, but there seems to be a struggle going on in some parts of that community. Bradley Cooper is now part of a group that's trying to look at the way vets are treated in films and trying to sort of look at it. And the struggle is, do you deal with the vet issue and saying, well, PTSD and the kinds of things are coming are just part of the picture, or do you deal with vets and there's a movement among vets saying not to talk about all of the ailments and not to try to typecast or stereotype? And what it does in this month's issue, which I hope all of you will pick up. It has a cover story by Jeff Goldberg, but there's a story by Gabrielle Glazer called The False Gospel of Alcoholics Anonymous. It's a very provocative and interesting story, but it raises the question of fuzziness and blurriness in figuring out what to do and how to do it. One thing is to surface the problem. The other is, what is the science that helps us begin dealing? Have you delved into that a bit?
Well, first let me say that part of what we have to do is get rid of the stigma, where it's okay to ask for help, whether you broke your leg, or whether you are depressed, or whether there's something out, or you're hearing voices, or whether you are having a heart attack. So it is really important. I think it is important to talk about the challenges they're facing, not to stigmatize somebody, not to stereotype. I mean, heavens, how many days you look at what folks go through in battle situations or other serious stressful situations. It's eminently understandable that someone would need some help with that. And so I think somehow we've got to be able to say it's not about don't talk about it or just talk about it but don't do anything. We've got to be able to accept that at various points in all of our lives we have stresses and strains, and sometimes that leads to illness, sometimes it doesn't. It can happen in a variety of ways. So that, I would say, is very, very important. I would also say, though, that then you have to have services available. And that's where, if we can have services available in the community, working with the local outpatient VA clinic and the community mental health clinic and the health clinic and so on, if services are accessible and available, and that's also going to make it easier in terms
now,
of
I
people
understand
stepping forward.
your Senate colleague Kelly Ayotte is stepping forward on some of this, the mental health. Is it first aid?
That's a great bill. I think the training
about
involved in that. I mean, I was original co-sponsor when Senator
Anybody a
Kasich did
CPR
that.
trained person in
But,
here?
I mean, the idea
No, not at all.
of
No CPR trained. 1, 2, 3, 4. Okay, we're okay. I was worried about the room here for a minute.
Yes.
But I think what's interesting about the CPR training, as I went into it, is whether or not people were trained or not, you have a sense that someone in the room will have been trained. Right. There's an awareness, not just for the training of actually saving someone, but you've densely packed in the population an awareness of the importance of it.
Right.
And I'm wondering if that's part of the trick, the angle of
really
this.
important. It's really important that teachers, law enforcement officials, counselors, social workers, others, but people have tools to identify early what's happening. A great advocate that helped us get the bill passed, my friend Glenn Close, has a foundation, Change to Mind, which it's a wonderful...
Change to Mind?
Change to Mind. And she's working on college campuses right now.
Wow.
And she's working on the whole question of depression, but awareness and students sort of learning for themselves what they're going through, or their roommate or others, and trying to help with early signs, to help people be able to reach out to each other, and that's very important.
Michigan doesn't exactly have a low death rate when it comes to police killings. I was looking at that. You're pretty high up there.
We are.
And increasingly this question of the mental health of some of the people that have been shot in these incidents is rising. Do you think there are more incidents today, or are we just realizing that mental health is more of a factor? And I know that you're in the Senate and you're not on the police commission in these cities, but how do you fix this problem?
First of all, I don't know. That's a really good question. I think that we've always had probably much more mental illness than we were aware or understood, or we gave it different labels than now. But I also think probably we're seeing, probably incidences go up. I would welcome what other people are thinking on this. If I could step back for a moment and say that one of the important things that's happening right now that has not happened in the past, when we look forward on how to solve this, is for the first time having a research project on the brain. President Obama, the administration, has come forward. The least researched organ in our body is the brain. And just think about other than the heart, the most significance of the brain. And so doing brain research is incredibly important. The more we know with that as well, the more we're going to be able to sort of figure all these things out, both solutions, but also...
Do many of your Republican colleagues get the brain research urge?
Urge?
Well, the brain research need, I mean, in other words, what you're describing, because you mentioned Paul Wellstone, great man, great leader, Ted Kennedy. You've now taken on this mantle.
Right.
It's a very Democratic tilting, crowd on the mental health. How do you look across the aisle, particularly when you're in the minority now, at this array of things in the mental health arena, things like the president has initiated in brain research, and make them resilient over time, which means you've got to get more of your Republican colleagues on board.
Absolutely.
So how do you do that?
Well, I mean, first of all, I'll reach out and work with anybody anytime that wants to. And again, very grateful that Roy and I have formed such a partnership and a friendship. Susan Collins was also very supportive and helpful on this bill. And so we have to continue to do that. A few of my colleagues that have now retired on the Republican side, George Voinovich was the early partner with me on this years ago. And so, over the years, I'm looking for people that are willing to do that. I think everybody in this room and everybody listening has got to engage in order to make that happen. We actually, very concerning to me, have a broader question of there's a whole group of people in the House and the Senate, and many of whom you could probably guess, but who really question whether we should even have the National Institute of Health or funding, that it should all be done by the private sector, which of course will never happen. Basic research is something we take the risk of. We together take the risk on basic research, right? Because it's very high risk, and it's only when it becomes more applied and you have some potential pathways to a solution that the private sector will come in. And that's not a criticism, that's just the way it operates economically. So, but we fight not just about the brain research, we fight with folks who would like to do away with the entire NIH. So we're having some pretty fundamental conversations right now about what do we do in a democracy to support, our quality of life and to support each other.
So I've got to bring it down to a lower level. Tomorrow, the Atlantic is having this giant health, it is tomorrow, right? The Health Forum, and you're all invited. Where are we doing it? The Reagan Building in the top level, and we're having this, and part of what we're discussing tomorrow are wearables. I have so many wearables on right now because I'm wearing them so that I can interview the people who've innovated. This is a little stress meter. So every 3 seconds this is buzzing because I'm apparently under a lot of stress right now, interviewing you. Mood rings, And I'm going to ask the guy, I sort of think that this operates on the same basis as a lie detector, with the things. But I'm interested in, this is cutting edge technology. We have the CEO of Fitbit, James Park, coming in tomorrow, and I find it fascinating that wearables, whether they're in Under Armour athletic clothing or it's a Jawbone or whatever it is, what it really is, it's a feedback meter that gives Steve Clemons some idea of what I was doing that I might not have even known. I may have a tendency, my colleague and friend and boss, Margaret Lowe Smith, often tells me and gives me feedback on things I've done that are out of control. And if I had a wearable for that, it would help. But I am interested in science, that kind of retrofitting of ourselves, and how you people in Congress are seeing that, because it seems to me that a whole new world is being built around us that you folks have very little to do with, right? It's,
there is a whole new world, and we're not doing as much with it as we should.
Okay.
But first I have to
That's a very diplomatic answer.
I am wearing a shiny yellow watch made in Detroit.
We're having Steve Bach come in and speak, pretty soon,
They have a new store here.
Sure.
Anyways, okay. Now for the commercial.
14th Street, right?
Yes.
Yeah, I've just in there.
So cool.
I have to say this band is particularly nice. Yeah, I want to.
Okay. But let me say, first of all, and give actually another shout out to. Oops, is this not working?
Okay, great.
Okay. Let me give another shout out actually to an entity in Michigan, the University of Michigan Depression Center, Center of Depression, Dr. John Graydon. They are doing all kinds of research work around bipolar, around depression and so on. And by the way, in the Affordable Care Act, at his urging, I authored a provision to create 20 university centers of excellence around the study of research on depression and bipolar issues and so on. So we actually passed that, and that's part of what we are working to fund. But through them now, they're looking and working with people with all kinds of new innovations, including something
Meters like this.
meters that could be that someone
Does
could
anybody
wear.
have these?
Maybe I don't know if anybody knows more about it. I'm just hearing a little bit
it's
about it.
fascinating.
But
I
the
mean,
meters
I-
that folks can wear that will actually help them as they maybe are going into a high. They're bipolar, they're going into a high, and it can help.
Well, yeah, I mean, I want, my goal in life is to get this into the blue when I'm moderating an event and into the red when I'm relaxing. And
How's
it'll
it
be
going?
Not well. Not well, but I'm working on it. But beyond just the funny side of this, it seems to me that as I've talked to people in the mental health area, and it's such a huge area, but there's no notion of whole health, right?
Yes.
What you just said between the head and the other physical parts is that these things, this is the first time where I've actually gotten the connection, and I'm being, stop it, penalized for it. But I think that when you begin looking at that, I'm just wondering, because when you go to the West Coast and you spend time with people who talk about the end of death and all of the kinds of possibilities that are down there, feedback, do your members, do the people you work with, I know that you get it, but as you work with your 99 other senators, as you look at your House colleagues, is there an understanding of how dramatic these shifts are in the country, or is there a giant lag effect?
No.
So when Linda is going up there and talking about mental health first aid, she has a high hurdle.
I would say mental health first aid is something that people are more likely to be aware of because it involves training. It involves traditional kinds of very, very important things, but more traditional. When you talk about technology, I would say when you go into the areas of research and technology and what's being done, what can be done to help people manage their own health, as well as research to the future, there certainly is a lag, and we need to keep working on that. The other thing I would say is, this is all about political will. First of all, when you look at research right now, and whether it's brain research, and by the way, brain research is not just about mental illness, it's Alzheimer's, Parkinson's disease, MS. I mean, if we really decided to double down on this, which is what exactly we should be doing, it'd be incredible what we could do. This is all a matter of political will and whether or not people are willing to spend the dollars that will save lives. And money, by the way. 1 out of 5 Medicare dollars is spent on Alzheimer's. So when you look at what can and should be done, it's all about who are we, and are we going to step up and do it? I mean, we're the United States of America. There's no reason we can't be stepping up and doing this and solving these problems. It's where I sit, there's so much wasted time on things that have nothing to do with anything, and don't get me started. And so, but the truth is, so there's just so much we can be doing and should be doing together that actually will save lives, give people tools, whether it's monitoring on their risk, whether it's medication, whether it's therapy, whether it's some combination of whatever, whether it's a cure down the road, that will help them manage diseases wherever they are in the body to be able to go on and live a long and successful life. That we can do this. We just have to decide we want to do it and that we're willing to invest in it.
Now, you were a social worker before you went into the Senate.
That's correct.
Any other social workers that went into the Senate?
There are 2 of us, Senator Barbara Mikulski and I. She says we are the only 2 official do-gooders in the United States Senate.
And Barbara is on her way out.
She's on her way out. That leaves me.
So what is that? I mean, I'm interested in the pathway that people have taken when they come into the Senate. So you had this experience dealing with people in stress circumstances. How do you, when you're getting together with members socially, and I know you occasionally do, I've bumped into you in a few of those places, how do you convey that? I mean, how do you build kind of common experiences and understanding so that people have a portal into those stressed out circumstances that others might not have known?
Well, again, I think a lot of it is just being willing to be open. and to be human. We're all put in a lot of boxes with a lot of labels that get in the way. And so it doesn't matter if it's members elected to the Senate or people in business or reporters, or it's a matter of getting past the mask and being able to connect on a personal level. It's amazing what we can do together if we get beyond the labels. And where I sit, it's also very important not to put people in corners. We got the Farm Bill done, we got excellence in mental health because it was about working together and giving people credit for things that they were doing, not one-upsmanship or not trying to, put somebody in a corner and bludgeon them, but to look in some way of how you can work together. And so if we do that, it's amazing what can get done, actually.
Have you been able to talk about these issues with the president?
I have talked to the president. I have been a part of his White House conference on mental health. I have talked to his staff. He was very supportive of what we did. His administration,
Do they get it?
Senator
Do they get it? Do they understand the priority?
They do. They have been working very, very hard on implementation. The fact that we...
So if you were to criticize him on any aspect of this, what would it be?
Well, it wouldn't be this issue.
Okay. But so I will.
Yes. No, I would say truly, when this went from a national policy on full reimbursement for behavioral health services and went to an eight-state pilot, it created all kinds of extra work to figure out who the 8 states are and all of this. So they've had to work really hard. Administrator Pam Hyde, and Marilyn Tavener, who unfortunately is leaving us, but Secretary Burwell has been terrific on this. And so I would say, they're working very, very hard with us. They're taking feedback when we've had areas where we felt it was not quite what we meant. They're going back and working with us to change it. And so, I think that they've worked really hard to get it right, and I praise the president on the brain research project. It is so overdue.
That's great. I want to open up in a moment to all of you, and we have a broader conversation. When we last spoke, I probably wasn't exactly right, but with the Washington Ideas Forum, I think you were Skyping me from your daughter's hospital where she was about to give birth. Something close to that.
It was close.
How did it go? And did she?
Yes, she had a beautiful little boy, her second
she was
little
literally
boy.
on the edge of giving birth.
So Steve,
and I was talking to Senator Stabenow, who kept looking at me. Well, congratulations.
Thank you. Yeah, I said, I said, I love you, but my daughter's having a baby, and that's important, and I want to be there.
And we still got 22 minutes out.
That was good. That was good. Yeah. So it went very, very well, and so he's now doing well. Everett.
Let me invite some comments here. We have Ambassador Stern here, Paula Stern. And then Kevin.
Thank you so very much, Steve, and thanks for calling on me. My question is about the mentally ill in the prison system, which is about 250,000, it is said, who are being punished for their symptoms, oftentimes with solitary confinement, which would make even Steve crazy. And much less, anyone who is mentally challenged. And I'm wondering, since we managed to kind of put them away when we closed so many of our mental institutions back in the Reagan administration, and they were all shown up in jail, we've given the police department this, quote, job, and they certainly don't know how to do it. I'm asking you to comment on that, particularly because I know there's legislation, I think, in the Judiciary Committee, which is being considered with regard to the mentally ill in jail. Okay. And specifically because I want to mention something called The Mind of Mark DeFriest, which is a film my son has out now in the theaters here at the West End Cinema on specifically this topic, which has won all kinds of awards, and I hope people will check it out on defriest.com.
Good plug. That's good. Okay.
I know.
Yes. No, that's important. I feel like there's two ends of this, right? The real solution is for folks not to end up in jail or prison
Right.
who really need
But in treatment, yeah.
And we had 50 different organizations, national organizations, endorse the Excellence in Mental Health Act. One was the national sheriffs. Another was the police officers. We had a really powerful support and testimony from some sheriffs who came in and talked about the fact that they don't want to be the place, that is the de facto mental health or mental illness facility. But too often that's what happens, and so they were extremely supportive. So the way to fix this, again, is on the front end, is by, first of all, creating a situation where family, friends, individuals themselves can reach out and get the help that they need. Second thing is the Excellence in Mental Health Act sets up a criteria for the new behavioral health clinics where you have to have 24-hour mental health services, psychiatric services. So at least if someone, in fact, is picked up because of a behavioral problem, they would have some place to go that would not be the jail. So that's, that's on the front end. Now, we still have a problem with people who are currently housed in prison and aren't getting any kinds of services, which is a whole another piece that is, really, really terrible. And that is state budgets and federal budgets, and it's going to take a lot of advocacy around that one.
And all that sounds like a big lift. Kevin Barron.
Hi, and thank you. And I'll start off, I'll butter up the speaker to say my parents are Michiganders. They're actually Yoopers.
Oh my gosh,
So if
that's,
you don't know what a
that's the
Yooper is-
Upper Peninsula.
That's right. If anyone needs mental health help, it's usually those people. Our coder is up there, and my folks. So I'm the executive editor of Defense One of Steve and Atlantic's sister publications here. And we actually have a lot of articles about brain research in the last year and how much is being done. What I want to talk about, though, is more about special operations forces. I just today was talking to one of our executives who had a brother who last year was a psychiatrist down at Fort Bragg for Special Ops Forces, but lost his post because the government funding ran out. And I thought, if any group in the military needs mental health care, it's the special operators, who are really, for the foreseeable future, the ones who are doing the trigger pulling, who are going to be seeing the worst of the worst, and who are still doing it now. It's really not American Sniper. It's not the Iraq vets. I mean, they'll have it for the rest of their lives.
So
in
just
their
for
own
my
way.
clarification, give me just define that person again. What?
This was one of our executives' brother was a psychiatrist working at Fort Bragg with special operators there.
And they lost their funding?
He lost his funding for that job, that post. Wow. They lost their psychiatrist. Now, there's other services, but that's just one thing. My point is, to what you were saying earlier, I'm very interested in the gap between the reality of what's needed now versus what's to come. And right now, and what the foreseeable future is going to be, are these specific guys. So what's Congress doing, what needs to be done to care for not just the Iraq and Afghanistan veterans of the last decade, but the coming decade? The special operators, the intel workers, the counterterrorism workers, who are people who, they can't even say they have a problem, or else they lose their clearance and they lose their jobs.
Absolutely.
Interesting.
The way to solve this in the short run is to stop what was a crazy policy called sequestration that cuts across the board regardless of the value of positions. I said on the Budget Committee, we're going to be bringing up the budget resolution in the Senate. We are going to offer an amendment that would do that, not just for defense, but also for health and education and National Institute of Health and all the other things but to stop that. We've now gotten ourselves out of the yearly deficit hole, more than 2/3 of the way out of the yearly deficit hole that was created in the last decade, that President Obama inherited in 2009. We're 2/3 of the way out of that now. So there's no reason to continue with this policy of across-the-board cuts. My guess is what's happening in defense is they're looking at what they would view as the support staff and cutting there first. And so I don't know this for sure, but I would guess that that's probably what's happening. So, and I will tell you that doesn't mean there aren't ways to save dollars. In the Farm Bill, we actually eliminated 100 different programs that were duplication, not being run well or whatever, and saved $23 billion more than sequestration. But then we turned around and we funded the things that actually were working, like local food systems and farmers markets and doing more things that that consumers wanted. So to me, sequestration is a cop-out. for not making tough decisions and taking the time to evaluate what works and what doesn't work.
Interesting. Yes, right here. We'll go to the front.
A little unstable, I just had knee surgery. So my name is Christy Kaufman. I'm the executive director of the Code of Support Foundation, which is a military veteran family support organization. The story that you told really resonated, I think, with the family member aspect of this, and that's not something that we generally talk about when we talk about bills that are, the Clay Hunt Act, and in terms of family member access to mental health for military and veteran families, particularly when you move to the veteran side of the house, you get basically none. And I'm talking about spouses and children who have gone through 13 years of continuous war, repeated deployment, which we have no precedent for. So I'm really interested in the bill in funding through community resources, because there are 1.1 million post 9/11 caregivers, over 4 million family members. There are only 16,000 that qualify for the VA program that allows them to get any mental health. So that means the majority of us are going out into the communities.
Right.
And so that funding at that community level, don't think it's going to come through the VA. I think it's going to have to come through SAMHSA. Is something that is significantly important to this community. Because I don't think that we have any handle on what that's done to this generation of military families.
That is so important, and I would just say that is one of the reasons why we need to expand community services, so that families in the community where they live, and even veterans who aren't close to a VA hospital or other services, can be in the community and get what they need in terms of services.
Can I ask an unfair question, just, and perhaps I'm about to step on a landmine myself here, in the sense that, is it kind of a cheap way into the mental health debate to sort of look at it through the perspective of returning veterans who've been stressed, that sort of undervalues the role of mental health challenges elsewhere? Or is it a useful point of leverage that you can use to sort of educate the broader community about the more holistic picture? I mean, I'm not looking at Linda because I'm afraid that she'll get upset at me about this, but no, I mean, but it's a fair, is it a fair question?
The opportunity
Yeah.
to use that community as a jumping off
Yeah.
point, because people have
Right,
a lot of
right.
empathy.
We're on video, so,
Sorry.
yep, but,
People have a lot of empathy for that community, and also our community, I mean, it's worse in the military community, stigma. So if you can figure out a way to break it, and by the way, the stigma on the spouse side, just as bad in terms of asking for help or whatever. So I think it's a good question, but I think it's a way to just kind of jump off and have that. We can lead the conversation, but it's obviously not just a military conversation.
I would say at this point, there is such need that when we were putting this together, I was using every leverage point possible, and because it affects everybody, and we were trying to identify as broadly as possible. So whether it's veterans, whether it's sheriffs, managing people in the county jail, whether it's families, whether it's children, I was looking at the broadest possible group so that we could paint a picture of how much this touches all of us. And there's no question that when we talk about vets, I mean, that got some people's attention that, frankly, we wouldn't have gotten otherwise. And it's very important, and families are very important, and so is everyone else touched by it. But in the political arena, we're looking for who people would pay attention to. And frankly, again, I'm so grateful to Glenn Close, who came in twice. Second time she came with her wonderful sister, Jessie, and who was diagnosed at age 50 as being bipolar, and her son, Glenn's nephew, who is managing schizophrenia, a wonderfully impressive young man who is married and doing well, but managing a disease. They were so helpful as we went to the offices that we needed to go to, and they were powerful in their testimony and very hopeful and strong. And so, honestly, I was looking at every possible way to get attention for how important this
an
was.
interesting Senate hearing to consider down the road. I'm someone who's sort of on and off on the value of bringing Hollywood celebrities into subjects like this. Everyone wants Bradley Cooper because he's done both American Sniper and Silver Linings, but people like Ashley Judd, Glenn Close. I've talked to some of the members, the cast members of Glee, who one of their cast members killed himself. And so what's interesting when you talk to them is that they go around the country and they're being pursued because they're such, touch points for people. Right. And they can tell you stories, vignettes that they have, where they just see enormous demand. Like, what's interesting is not that they're so famous, right. It's that the demands on them are so incredibly pervasive and overwhelming. And I just want to again raise the fact that there is a huge current of interest in this.
And I have to tell you, Bradley also joined me for a press conference with Patrick Kennedy. It was the first one that we did, and he and I, talked after American Sniper, and I know he's very passionate about this.
Yeah. Yes, right here.
Yeah. Hi, Michael Laskoff from Able2. One in 5, I have ADHD. That's pretty easy to deal with. And I employ about 400 therapists in a private company. And the question I think that I'm actually surprised that in all of these debates isn't coming up is all of the wonderful new things we're doing, everything about technology, everything about funding, but we can't do simple things like we don't have a telehealth law that makes any sense. And the simple fact of the matter is we're spending, and frankly, you've spent an immense amount of time and energy to a very good cause to put facilities closer to where people can get them, but today you can actually move that directly into people's homes in most cases, and it's against the law in many places. We can't cross state lines, we can't do things to utilize the actual workforce that we have. Now, be honest, from a private business perspective, that actually works very nicely to our business model. But from a public good standpoint, we're not talking about access in a way that utilizes technology in an intelligent way. Is there any hope that that is going to become part of the sort of discourse of things that need to be changed?
Yeah,
Thank you.
I would love to talk to you more about that, particularly about it being illegal crossing state lines. I will say, I hate to keep going back to the Farm Bill, but under the rural development part of the Farm Bill, we put in there, we fund telemedicine in rural communities.
In the Farm Bill?
Yes, through rural development. It's amazing. This is not, this is not a farm, this is not your father's
not
farm
your
bill.
father's farm
No. This is a huge, rural economic development, we fund housing and small business and telemedicine, a whole range of things in rural communities. And some of our VA clinics, outpatient clinics, and one real priority for me in Michigan has been to get the outpatient clinics in northern Michigan and the Upper Peninsula and other places. They're using telehealth in a mental health capacity, and they've set it up in a private room for an individual, and I'm sure you're aware of how that's done. But if there are barriers, I would love to talk to you about what those are.
It's important. Yes, right here. And we're going to...
Thank you very much. Nancy Sherman. I work with veterans, and I teach at Georgetown. I'm bringing out Afterward this month. Just 2 points. When PTSD got the initial diagnosis, that was a confluence of women who were sexually traumatized and veterans coming home from Vietnam. So, there was leverage on both sides, and it worked to their advantage. On the question, I know brain science is amazing, but we also need education that isn't biofeedback. I'm in a classroom, I'm always mentoring kids. If you're a professor, you get your triage, to the next door. And not many of us are psychologically minded, where we pick up someone's revving, or someone's getting manic, or they're not just obsessing about something, there's paranoia there. And you can talk to very, very educated colleagues who don't always pick up the symptoms. So public education is people that are symptomatic, that are using defenses in ways that are going to crash on them. And whether they're still former special officers, special forces officers, are very tight until they're not tight, and then it falls apart for them. So public education about little clues, these are continuum spectrums, and people are all over on the spectrum.
And I would say absolutely on public awareness and education. And also, we need more people in the helping professions, right? I mean, when I think about, when I started out, I was going to go into school social work, and I was assigned to a high school and a junior high at the time, and actually did home visits. Now you see, if there is a school social worker, he or she is spending all their time doing paperwork, and they've got 25 schools, and they've got, so so we've got to decide as well that the social worker, the counselor, the psychiatrist, the psychologist, the other helping professions are valued, whether it is in the military to make sure that they're there, or making sure they're in the school, or making sure that, you know, we are actually valuing that as a part of healthcare.
Well, I know you have votes. I just wanted to say, just as we wrap this up, that it's such a privilege to be able to spend time with you, actually having a nice conversation about an important subject from the various different corners about mental health. I know that my colleagues and I at The Atlantic feel like this is something that we want to elevate across many of our programs, not just at a forum on mental health, because I think that, and I think you would agree that it needs to come out of the closet in the sense that it's not there. And I also, you know, find myself in this forum tomorrow. We have a woman, I think you know Shannon Brownlee, who wrote a piece on the called "The Overtreated American." She's sort of an iconoclast in healthcare, and the lack of empiricism that continues to exist in the medical world. But part of the way you get empiricism is being able to study stuff that's out there and that's happening. And so I just wanted to thank you for being willing to, because we've had this conversation a few times, your willingness to continue to come out and discuss it and talk about it, and to talk about it with your colleagues, because I do think it's important.
Well, I want to thank you and The Atlantic. I mean, I love the fact that when we first talked, you said, I want to do this, and that took us a little while, the weather.
We met at a dinner, and I said,
I want to do this. And so, but because that's what's so important, too, is, you know, in the list of all the things that we could talk about, making this a priority is a big deal. So I want to thank you for that.
Well,
and thank The Atlantic for
ladies and gentlemen, Senator Debbie Stabenow. Thank you, Debbie. Thank you. Okay, folks, we're adjourned.